Testosterone is the king of all steroids. It is the best steroid going for us men. And if I could only ever use one steroid, it would be testosterone. And that's because it's a naturally occurring hormone in our body. It's bioidentical, so our body can utilize it. Your first ever cycle should be a testosterone only cycle. And going forward, testosterone should be the base of all cycles. So what can you expect? Simply put, you're going to be bigger, you're going to be stronger, and you're going to be faster. You'll be able to recover better from your workouts. There'll be an increased ability of your body to build muscle and burn fat, providing you're training hard and you eat right. Testosterone also stimulates red blood cell production. So what that means is you're going to have more red blood cells floating around your system, which means better endurance. Chances are you're going to have a better mood, and of course, libido should be massively improved. So when it comes to administration, injection is going to be the best option. It's the most effective way to keep your blood levels stable. So if you're scared of injections, this game is not for you. So when it comes to esters, you have fast acting and slow acting. Testosterone propionate is a fast acting ester, and you need to take the injections every other day ideally, but at the very least Monday, Wednesday, Friday. Testosterone enanthate and testosterone cypionate are very similar, and you can get away with once weekly or twice weekly injections. Sustanon is a mix of esters. Again, you can get away with once weekly at a minimum. You also have testosterone suspension, which is esterless, so it's just straight into your system and it leaves pretty quick as well. And that's mainly utilized by powerlifters just before a powerlifting meet. Side effects, the most common are testicular atrophy. That means your balls are going to shrink. And that's because of the negative feedback loop. Your body senses that you're injecting testosterone, so it doesn't need to produce its own testosterone anymore, hence why your balls shrink. Some people get acne if you're prone to it. Some people get male pattern baldness if you're prone to it. I've obviously got a lot of hair, but I have noticed that my forehead has gone a lot bigger than what it used to be. Now, whether that's down to age or testosterone therapy or a combination of both, I don't know. It will have a negative impact on your cholesterol level, so cholesterol is going to go up. Now, because testosterone stimulates red blood cell production, your blood is going to get thicker than normal, which could potentially mean that you're more at risk of strokes, heart attacks, blood clots. Then you have water retention, high blood pressure, and gynecomastia, which are all side effects due to the conversion of testosterone to estrogen. When it comes to dosages, for TRT, 100 to 200 milligrams is about right, obviously based on blood work. Your first ever cycle should be between 200 and 300 milligrams of testosterone only. When I was coming up, it was commonly recommended that 500 milligrams should be your first cycle, and that was just far too high, and I'm speaking from personal experience. As you progress, I have taken up to 600 milligrams of testosterone a week when I was competing, and I know friends and fellow competitors that have taken a gram, 1500 milligrams of testosterone. In terms of cycle length, minimum 8-week cycle, especially if you're taking the test enanthate or the test cypionate. Ideally, it should be a 12-week cycle. The more experienced guys can do 16 to 20-week cycles. Some even do longer.